Time now for the live coronavirus update for San Antonio and Bexar County.
Tonight we're joined by Dr. Anita Kurian, who is our Assistant Director of San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 709 new cases, bringing our total to 74,591 since the pandemic began. We've continually see higher daily counts, and the 7-day average is now 549. Fortunately, we do not have any new deaths to report tonight, but please keep loved ones and your family and their family and friends in your prayers. It seems as if everyone in our community knows someone who's succumbed to this virus, and we ought to keep them in our thoughts and prayers. We have 509 COVID-19 patients in the hospital tonight, which is up 17 from yesterday and up 43 from Saturday, a significant increase. We have 171 patients in the ICU and 80 patients on ventilators. Monday, we will take a look at our progress and warning indicators. 6 of the 7 indicators remain the same as last week. The change this week is in the positivity rate, which now has up to 10%. Positivity rate is now orange or severe. This is despite a record number of tests. More than 42,000 people were tested in Bexar County last week, the highest weekly total since the pandemic began. And overall, we remain in the moderate risk level as a community. Our case numbers and positivity rate continue to march steadily upwards. So today, Metro Health Department is urging San Antonians to avoid all indoor activities with people outside of your household, especially when you cannot wear a mask. This means that whether it's in a restaurant or your friend's house or your own house, this is not the time to be indoors with people other than your immediate family. The state has taken away much of our authority, so we are recommending you avoid indoor settings with folks that are not part of your household. I also want to let you know that the city is stepping up enforcement of the state's orders. We've assigned new officers to conduct proactive inspections, and we are able now to do 350 inspections per week, which is more than twice what we had been doing. I want to emphasize that many small businesses are doing their part to ensure you have a safe surrounding. Please help them out and support those who are enforcing those orders and paying close attention to the public health guidance. But at the end of the day, it comes down to you. So please listen. We are talking to you. We cannot stop this virus if you don't change your behaviors. If you don't heed the warnings this Thanksgiving holiday, you or your loved ones could be spending Christmas in the hospital. That's just the facts. We also have an update on the dangerously low blood supply as blood drives continue to be canceled because of the pandemic. We still have less than a 2-day supply of total blood inventory and less than a day's supply, in particular of type O blood, which is used in emergencies. With the Thanksgiving holiday this week, additional declines are expected. So the South Texas Blood and Tissue Center is working to establish at least a 3-day supply, which is the minimum to meet the needs of hospital patients, with the goal, of course, of reaching a 7-day supply. The lack of a reliable blood supply is putting trauma patients at risk and threatening hospitals' ability to schedule surgeries. The South Texas Blood and Tissue Center, it has 6 donor rooms in this area, so please, if you're able, make an appointment to donate at southtexasblood.org, or you can give blood at University Hospital, and you can call them at 210-358-2812. Let me turn it over to Judge Wolf.
Thanks, Mayor. And we're reaching the point that's going to be an inflection point for us, and that's Thanksgiving. We're going to have to be extremely careful here. Number one, you're going to have a lot of college kids coming home, and you may have some in your own home. I believe out of the 5 universities we've got here, 4 of them are not coming back after Thanksgiving. So you're going to have young people coming back. I would say if the college hadn't done the test before they left, and many are doing that you might want to consider having a test done of your loved one when they come back. The greatest threat would be them to come back, spread it to the rest of your family, and then you got trouble. And that's happening quite frequently where the younger persons mostly come back home, and then you've got a real problem with your whole household. We are testing a lot more people, and that's why you're seeing a lot more positive cases. Part of the reason why you're seeing a lot more positive cases. We're at 10% now. Quite frankly, I was worried that it'd be a lot higher than that because we had such high numbers of people that were positive. But we're testing 42,000, as the mayor said. That is a tremendous record. The other thing I would say to you, that if you're planning on travel, don't do it. I think that's just another hazard that you're going to be entailing, and there's no reason to do that if you can possibly avoid it. So Thanksgiving, I hate the fact I can't get together with our big expanded family, and we've got a big one, but we're not going to do it. And I would suggest that you consider doing the same thing that we're doing in our family, and just have a little small group, maybe 2 or 3 or 4 of you for dinner, and do it on different days. But don't get a lot of you together again and jeopardize everybody in your family. As we know, the drug that Pfizer has done, Bamlin, I'm going to say that Bamlin, the first part of it, I can't pronounce the whole word, is now starting to come out in small quantities. It's one that you have to take intravenously, and it's for those that maybe have these bad symptoms and maybe preclude a visit to the hospital, but it takes about an hour to do that. So we're talking with the hospitals and everybody about possibly making the field hospital out at the Coliseum available for that if they want to use it. Now, following on its heels is probably going to be another one called Regeneron that I think has not been approved yet, but might be in the next few days. That's the drug that President Trump took when he went to the hospital. Certainly must have had an impact on him, because he certainly got out very, very fast after that. So we're working toward that. And then you're going to hear a lot about the vaccine the governor rolled out.
This briefing is continuing right now on KENS5.com and our Facebook page. Tonight, there is a big jump in cases, 709 new cases, bringing the total to 74,591. The 7-day moving average also going up again. Patients hospitalized also went up tonight. Fortunately, there are 0 new deaths. The total deaths now at 1,335. City leaders urging all of us, as they've been telling us this past week, to not get together with people who are not in your immediate household and to hold gatherings indoors. Now, if you can donate blood, there is a big need right now. There's less than a 2-day supply of blood, and even less for type O blood. We're going to take a quick break. We'll be right back.